Hello and happy Pride. I am Admiral Rachel Levine, and I'm the Assistant Secretary for Health at the United States Department of Health and Human Services and the head of the United States Public Health Service Commission, CORE. And welcome to our Pride series. We are here today with Barrie Rose, they, them pronouns, an LGBTQ plus content creator, advocate, and musician, and Laurenzo, they, them pronouns, an LGBTQ plus content creator, educator, and advocate. Thank you so much for joining us today.
So happy to be here.
Great.
Thank you.
So, this is about LGBTQI plus health. And so we'd like to think about what is an LGBTQI plus health topic that is important to you.
For both of us, gender-affirming care is a very important topic. We work a lot with LGBTQ youth in Ohio and also in our online platforms. And we've been trying to talk about the definition of gender-affirming care to be able to help others understand what it really is. We specifically try to focus on the fact that it can be lots of things,
right.
Like hormone therapy. It can be surgery in some cases for some people, but it can also be simple things like respecting someone's identity, their gender identity, and using their pronouns.
Right.
So that's an important part of the content that we make.
Thank you.
Yeah, and it's been super challenged in the United States because there's so much misinformation out there and people thinking that it's some extreme thing when really just having an environment that supports and affirms people's identity is the most important thing, because there's been numerous studies done that it just helps people's mental health.
Yes. I've often said that gender-affirming care is health care, it is mental health care, and it can actually be suicide prevention care.
Yeah, and especially with the LGBTQ youth that we work with, that's a huge focus for us. In this past year, we actually had gender-affirming care taken away in Ohio legislature for younger folks. So that's been really on our hearts in the work that we put out online and also with the students that we hang out with.
Such a challenge. Now, how can outreach and representation, both online but also in person, create that sense of community and belonging for LGBTQI plus youth?
This is something we're super passionate about. We started a program this past year called Queer Hangouts, where we go to high schools in Ohio to hang out with the LGBTQ clubs there. And that originated actually from a student who was just watching my videos on YouTube and cold emailed me and said, would you be willing to come to my school? We live in Dayton. And I had never done something like that. Even though I had been in academia for 10 years at Ohio State, I had never really hung out with high school students and talked about LGBTQ issues.
Right.
So I went down there and had an absolute blast.
That's great.
And it was really just that moment of realizing that as an adult, as a queer adult, just your presence can make a huge difference in one kid's life.
Absolutely. In fact, there's a study that shows that from the Trevor Project, that just having one supportive adult can make all the difference in terms of their mental health.
Exactly. So we started Queer Hangouts, and then the second visit, Barrie came, and we've been doing that together ever since this past year, visiting various schools in Ohio, and it's been amazing.
That's great. What are your thoughts?
Well, we do have online communities in that, like, we have a lot of LGBTQ young people that are watching our videos.
And parents as well.
Yeah, and parents. But having these in-person connections and actually having conversations one-on-one or with a small group has been it's been amazing just to be able to really have like a deeper discussion and see what people are actually struggling with in their real lives and just be that supportive figure that we actually didn't have when we were younger. Like, I don't think there was a GSA at my school, or I didn't know about it. I didn't have any adults that were positive representation for me. Otherwise, I probably would have come out and been comfortable with myself a lot earlier.
Well, school programs are so important. Now, I know you all work online, so how can content creation help to dispel misinformation about LGBTQI plus health? For example, we were talking about misinformation about the HPV vaccine or about sexually transmitted infections like syphilis. Tell me your thoughts.
Yeah, I think that the online space is so new these days with young people being on there. It's important to be able to share information that's backed by resources. And we do collaborations with organizations, nonprofits especially, who help us even to get the right information sometimes. We can read through those briefs and make sure that we're sharing the most accurate, up-to-date information, especially reproductive rights content. We've been doing a lot on that. Gender-affirming care, which we've been doing work on. And also just like hormones in general, like how to talk about what is how hormones work and how we can like have more information for ourselves.
Absolutely,
as we can
that
educate
information
ourselves.
is so important, but accurate information. Your thoughts?
Yeah, I mean, I feel like the content we make is, well, for me, it helps bring about dialogue and conversation in real life. And sometimes it's about simplifying big subject matter that's hard to understand and making it digestible for people. So if there is misinformation out there, that can confuse people. But if they watch a video that kind of simplifies it and makes it maybe more centered in humanity and centered in understanding and compassion and learning and more of a lighthearted approach to a heavy topic, like maybe they'll start to like have different thoughts about it.
Right.
And see how it relates to actual people.
Exactly. Well, thank you so much. Now, of course, it's Pride Month. What does Pride mean to each of you?
Well, we just went to the Columbus, Ohio Pride last weekend. There were over 700,000 people there, which was incredible. And I did not come from a supportive family. My family was very conservative and religious, and so just every year now being able to celebrate Pride is this space to feel like I can be myself and have family, you know, chosen family as we often call it in the LGBTQ community.
That's right, our chosen family.
Indeed, yes. And so that's really important to me, and also just to feel like we're not so alone. I think going out and seeing so many people, it's that sigh of relief that, okay, there's other people like me and there are other people out here that will support and we can support each other in
Absolutely.
that way.
And your thoughts?
I think overcoming all that we have in our life to be able to be our true selves is what Pride's about. We've individually gone through a lot to be able to claim who we are, but also collectively as a whole, you know, if you look at history, like queer people didn't have a voice and a chance to be themselves for so long that it's a statement to say, yeah, we're proud of who we are and we love ourselves and we have other people that support and love us as well.
Absolutely.
So let's just celebrate that for a month.
Absolutely. We should celebrate our rainbow family, so to speak. Well, Pride gives me hope for the future. Be honest with you, you give me hope for the future. So thank you so much for joining us today. So thank you, Barrie and Laurenzo, for being here today. And remember, this Pride, we are stronger together, and it's all about pride.
Produced by the U.S. Department of Health and Human Services.